Us 1 month ago, the Mayo Clinic Health System-Fairmont announced its decision to cut labor and delivery and surgical services early next year.
This sparked a public outcry, and tonight the hospital hosted a public meeting to address community concerns. Sophia Jernander takes us there.
Rural healthcare it's broken.
Just over a month ago, the Mayo Clinic Health System-Fairmont announced that it would be cutting inpatient services for labor and delivery and surgery. The decision sparked outrage throughout the community.
But what I've seen in the last year or two is the diversion of our patients to Mankato, where our own obstetrician is going up to Mankato and covering the call there. So of course we have no coverage here.
Monday night, MCHS hosted a public meeting with the citizens of Fairmont to hear concerns about their new transition.
We have every intention of maintaining a long-term presence in this community. And we as a Mayo Clinic have no intention of closing the hospital.
According to MCHS, they need to reduce services due to a nationwide shortage of both obstetricians and surgeons. After that, they will focus on sending patients to Mankato or another hospital of the patient's choice.
Well, over the past several years, we have seen a significant decline in the number of births performed and happening right here in this campus. It's not unique to Fairmont. It's not unique to Minnesota.
However, those in attendance are worried for the future of healthcare in Fairmont, citing its aging population as cause for concern.
We have a significantly large, older population, and they have lots of medical need. And so I think that people are going to be going elsewhere.
While residents fear for the future of Fairmont's healthcare, MCHS says this is not a decision they wanted to make, and that they will do everything possible to provide for their patients. In Fairmont, Sophia Jernander, KEYC News Now.